will move on to questions about second opinions, which are really important for patients who have a rarer disease like MDS. What are your views and your views on patients who request an additional opinion? How do you generally react? And does it actually offend you if people ask for a second opinion or an additional opinion?
I have a very open approach to practicing medicine. I feel very strongly that patients should have the opportunity to see a true expert in whatever disease they have. And I think that the reserved UK personality trait is one that doesn't naturally push for this kind of expertise. And I just find that concept quite difficult to understand, because that's not a concept that I would take forward if I had an illness. The fear of offending is obviously real, and that's a British personality trait. I don't think that that's really grounded in much real evidence. I would be surprised if a good, caring doctor would be offended if a patient said they wanted to go and see somebody else for another opinion. I'm sure it happens, but it surprises me that does happen. I don't think patients should be really of that mindset. They should try to get an opinion from a specialist wherever possible. And that's part of the reason that we put into the national MDS guidelines that every patient should have an opportunity to see at least a regional or a national expert in MDS, because the disease is rare and because the science and the treatments are evolving quite rapidly. So I think now more than ever, patients should take the opportunity to see an expert and get second opinions if they feel that they would want more information. But I think the problem is that empowering the patients to do that is quite challenging. And of course, the MDS UK Patient Support Group attempts to empower patients effectively, but more by the patients coming to them than by them going out to every single MDS patient that's diagnosed. That's simply not practical. So I think we have to empower the clinical nurse specialists to try to encourage patients to get the maximum information that they can. And we have to find some way around the fact that our colleagues working in all the hospitals around the UK are so busy that it's very difficult for them to think about getting extra opinions. There is a nihilism about MDS because there's been so few drugs historically. There's always been a nihilism saying that we all know how to treat MDS, we just give them blood transfusions and growth factors. And that's true to a certain extent, and I would accept that. But what the specialist can offer, what the expert can offer, is a detailed review of the specific context for that individual MDS patient, taking into account the advances in the biology of the disease, taking into account the experience of that MDS expert, who will have seen a lot of patients over the years, and imparting much more information to the patient than is conceivable in the local hospitals, because there just isn't time for detailed conversations. So when I see a referral for a second opinion or a specialist opinion, I try to allocate at least about 40 minutes of my time to talk to patients in detail, and I try to make it quite clear that to them that the type of MDS that they have is what we're talking about. It's not a generic conversation, it's a very detailed conversation. So most of the patients that have that time commitment and that level of detail, I think they feel better for just having had that information. Usually nothing changes in terms of the treatment that we recommend, but at least they're empowered by information, and they can rest knowing that there is nothing else available for them. And we know that as specialists when we receive a referral, and the referring doctor knows that. but it's still reassuring for the patient if we can all come to that conclusion. So I have no problem with referrals, and I refer patients all the time for other opinions. I have a set of colleagues who I work with nationally and internationally, and if I have a difficult patient here, somebody I'm really not sure what the right thing to do is, I will often send an email to 5 or 6 of my international colleagues and say, I think this is the right approach, but I don't know, actually, I'm not sure. I have this nagging doubt in my mind. What do you think? And again, the patient, when I tell them, I'm consulting widely on this. I don't really know what the right thing to do is. It's not that I don't know what I'm doing, which is of course one of the fears that you might have when you're doing that kind of thing. It's that I just don't know what the right thing to do is, because there is no right thing to do based on the evidence. The evidence doesn't help us. So if you ask around your national and international colleagues, and you get a series of opinions, at least you can come to some sort of conclusion that's based upon an evidence group that is larger than just you making that decision individually. So, yeah.